Hello, hello. Welcome, y'all. Today, we have an amazing guest speaker, Dr. Neel Bulchandani. He's been with us before, but I don't think anybody in this crew has heard Dr. Neel before, which is kind of amazing. You might have heard him on a podcast or two, but what the tie that originally got me introduced to Dr. Neel was the tongue tie midline rabbit hole, and that is where I got introduced to Dr. Neel and his work and his compassion and his perspective on a lot of things I just really resonate with. And he's a chiropractor. So, of course, I love him. But I'm going to turn it over to Dr. Neel because I want him to introduce himself and let you know who he is and what he does. Because even since I have been introduced to Dr. Neel a few years ago, everything's kind of evolved for him, and he's even moved cities. Like he's his work life definitely looks different than when we first met. So, Dr. Neel, introduce yourself.
All right. Well, first of all, Lindsey, thanks for having me. And it's been just a blast to stay connected, especially from talking with you on the podcast last time. Now, So just for like a setting, I'm in Santa Barbara. There's State Street or Cliff Drive, like downtown. There's the wharf. There's the
Oh, beautiful.
So I'm like, today is mostly remote work, but including getting to talk to you all. So I was just like really tearing me up inside of the thought of being stuck in my office. That's why I was a few minutes late. I'm like, I have to get out here because I have to, so, you know, aside from being, living in Santa Barbara, my wife, Dawn, and then our three kids, we moved here just 6 months ago from Redding, which is way up at the top of the state. It's way more like Oregon, in the trees near Mount Shasta. Loved it there, but being here has been like a great line of demarcation on a new chapter. And part of that is just, as like, Lindsey, you were sharing, it's like I feel like getting to be deep immersed in like tongue tie and airway and feeding care with journeying with so many moms and babies and families. um it would naturally bring me down to the Bay Area, and then this area well, the Santa Barbara, but then I go into LA at least like once a week to work, and then that's just led me to kind of expand out and have people come to me where they're not coming for like tongue tie or airway. They're coming because like their face is paralyzed, sadly, and they've just heard that I work with the mouth. And then so we're not working on like, so to speak, tongue tie, but then I find out, well, they got a really considerable one, and that's playing a role. Or this one woman who came to me from Malibu, she drove in an hour and a half away, and it was basically a neuropsych guy who referred her, who she's being like diagnosed with ALS, and Lou Gehrig's disease, but it doesn't match. So she came in and she tells me 8 months ago it was due to like psychosocial trauma and other things. And we're working on like so many things related to concussion and deep emotional trauma from, being in a situation that wasn't safe. And so I think like, even though I'm still with the floor of the mouth and how that relates to the whole body, people are coming because they're just dealing with issues that they can't figure out what to do. So I just
And
feel
they,
privileged that
yeah, they want that root cause.
yeah, yeah,
Yeah.
yeah. So yeah,
So amazing. Okay. So can you give this crew a little summary on how you got started in your niche first?
yeah.
'Cause tongue tie, feeding, airway specialist from chiropractic school, is a very like, okay, we're taking a hard turn into this path, right?
Okay. First of all, I want to acknowledge that I'm presenting to amazing people. You're like experts, and the reason I call myself an airway and feeding expert is because I was getting told by the leading tongue tie experts in the world, like who I collaborate with, Neel, you need to call yourself an airway this, airway
Right.
that. Yeah, but what about feeding? Like, so I
Yeah.
want to say right out, I'm like, unabashedly, unashamedly saying that we need the feminine back in healthcare because it's just really ridiculous that we don't have the feminine voice. I mean, men and women speaking with the feminine. And I've learned
Yeah.
from my wife, Dawn, let me look from my mom and my sister, but then my wife, Dawn, and then my kids, but especially my oldest, who's Serenity. Uh, like what does intuition need? What place does intuition have? And like for me, it's like 100% of how I navigate. Second to
Cool.
that are protocols and like this is what I do and when I do it. But the only way I figured out things was from intuition. And my daughter, who's the one who got me into like this rabbit hole of airway feeding, like really it was from following her. So Serenity Sky Bulchandani 9 years ago was born, the oldest of our three kids, and she was born with a tongue tie. We didn't know, like when she was born, our shout out to the midwives. I love Becca Frankie. She's been our midwife. She was for all three of our kids. She spotted the tongue tie. I had no idea that existed. So anyways, we had good friends also who said you need to get this, proper body work. And so that didn't work. So a tongue tie release, night and day difference, hands down, the best decision we ever made. Those 2 weeks that we went trying to solve it, um, I can reverse engineer it and say like we did all the things, and it wasn't those frena were so restricted. So thank God we got it released in the Bay Area surgically, and that was night and day afterwards. It wasn't easy, but that's when
Yeah.
I kind of got to figure out, whoa, there is so much more to this um, than just loosening up the mouth as a body worker, as a chiropractor, adjusting the cranials. All that was really helpful. But I had to learn to work on organs. And then I had to also learn to navigate the nervous system. And then I had to find out when, when that day Serenity was experiencing tension in her, kidney or her stomach, not from her issue, but from my wife's issue, because they're intricately connected. So to figure out the empathic realm in how I need to navigate like patient cases, that was Serenity was a huge teacher for me. Um,
Oh.
and then, but before she was born, she taught me greatly because we would put on, so at the Doppler, readings at the midwife appointments, we would record her heartbeat, on the pathway to her being born. And I would listen to those recordings and hear her heartbeat. It's super fast. And then I started running, and I defeated asthma during the time that my wife was pregnant because I would go out and run in the mornings. I would put on my daughter's heartbeat, the tracks, and I would run to the rhythm of her heartbeat. And when I ran an ultra marathon, was like 2 months before she was born. Um, it was a big breakthrough for us because I had been so limited by my asthma and breathing. So I would say again, like when I struggled and I didn't know where to like put my feet when I was super tired, I like on that like soundtrack that I was playing to make sure I could make that ultra and do it well, I would hear her heartbeat just come on, and it
Oh.
would be like so that's like a symbolic thing too of
Yeah.
even now, 9 years old, we're navigating things where we need to figure out how to help her regulate her nervous system as I do. And so I think like that's, just that's what got me into the rabbit hole of this was seeing my daughter be born with this issue. And then after that, other kids too. And then
Yeah.
just just definitely the privilege of getting to be in this is great. I would have loved if we never had this issue. Like
Right.
some people are like, well, if you didn't have this issue, you wouldn't know what you're doing. I was like, hey, I'd rather have figured out how to surf really well or something like that than deal with this issue. But thank God that I got to be in this, and then I
You were chosen. Yeah.
got to listen to the downloads that came. And that's been a really beautiful overall hard journey, but beautiful journey.
Yeah. Oh. All right. So a lot of what you do, and I'll try to integrate all the things since I know a little bit about how you practice and what you're evolving into. But a lot of what you do, right? You touched on addressing organs and muscle work and cranials and like the energetics of the body and listening to basically a higher power, your intuition, listening to the little ones, because they don't get heard nearly enough when they're little because they don't speak our language, right?
Yeah.
Um, how much of it, uh, let me start with this. How much of it ties back? Like, let's say if somebody like Serenity or another child has a tongue tie issue, or if you even call it a midline issue, how much of it ties back to, um, pregnancy or conception or the previous generation? Um, can you touch on that? Because I know you were writing some chapters on primitive reflexes, and I don't know if you want to interject that here.
Yeah. Yeah, no, it's definitely good. I mean, yeah, so the chapter I'm writing in a book on primitive reflexes is by this amazing tongue tie surgeon in the UK, Dr. Suraj Batish, who asked me to write that. And it's really like about my floor four, which is about the connection from the floor of the mouth to four main areas in the body, but then it's really about 70 areas. But then if we like distill it down to four main areas, and I'm only gonna put it like this because it makes it like really stand out in terms of how important these areas are these are the four main areas in the body that are critical for when you work on them and you check back with the mouth, you see dramatic reduction in tension. And you also see the floor of the mouth change so much that the tongue and the lips and the cheeks, the head, we talk about all the, if we want to get nitty gritty, we talk about the sphenoid and the parietals and the temporals and the frontal, just all the face bones, the head bones, and then all through the body. It's this dramatic release that I usually like to get to within like 5 to 10 minutes after I start working on somebody, so that then I have access to working on their whole body. But in that time, it's this swirl of integration of the brain where sometimes the reflexes that are that haven't integrated yet, they just integrate these primitive
Yeah,
reflexes. And then also because I would say and I'll just differentiate, like I'm working with tongue tie all the time. It,
yeah,
I'm considered somebody who, like in our little world here in like SoCal and like the Bay Area, or it, or when I'm virtually consulting, usually I'm getting the people who have been to everybody, or they haven't, but they're just like, what's going on? How do I get this mandible to come forward? How do I do all these things? All the nitty gritty. Um, and if you're, talking about like kids within expansion, any kind of palate expansion, same.
yeah,
I'm traversing those like waters, but we're trying to get things to shift so that we can be healthy. But I'm working with tongue tie and palates, but the floor of the mouth is this holistic approach of the floor four where I can work with these areas and see dramatic shift regardless of what people have going on. But I will be careful to say, like, I do not at all promote that I am in taking the place of a surgeon or an ortho, because I collaborate with them and I'm like, we just need it all. We need the people
yeah,
when we're navigating some of these cases. So that's important. But I think that when I see back down to like your question, yeah, it's definitely midline. That deep front line of fascia that goes from Tom Myers is the guy who
yeah,
anatomy trains, right? Tongue to the toes, but I've kind of furthered some of like the extrapolations of like that's true, but we're born with a spiral pattern. And so we aren't symmetrical. So it goes up to the right sphenoid and it crosses down to the left trapezius and it goes down through and it goes to the plantar fascia. And so I think there's like, and then we have to expand out, like you said, to include the organs. But I see babies, then, their parents bring them in, so I'm looking at them and I'm checking in their mouths. When I have grandparents in the room, I'm checking in their mouths. Then I've had the fortune of two families I've navigated where the great grandparents are in the room also. So
mm,
I'm checking everybody's mouths, right? I'm
yeah,
checking all their bodies, working on all of them in this big swirl because sometimes it's releasing mostly like the grandparents, right kidney or something is what ended up releasing the baby's right kidney empathically, right? It's like when it happens, it's just like that happened. I can't refute it. And I'm gonna look for that now every time. So when I look in the mouths and I see in that great grandparent the same issue, tongue tie, lip tie, cheek ties, and tori, on the mandible. And then I see in that baby tongue tie, lip tie, cheek ties, tori, bony outgrowths that have come from the mandible. I'm like, that didn't happen in utero. That happened.
Yeah.
That happened in utero of that when that great grandparent was in their mommy's tummy, and at least. So that's my extreme example of like, not to get hopeless, but some of this stuff started way long ago, anthropologically, culturally.
Right.
Yeah, then we have the things that are like, yeah, trauma when a baby's forming at that 4 or 5 week gestation. Clearly, that could very well be the time when epigenetically there's this shift where instead of what should happen at that 11th week is the tongue tie and the lip tie and the cheek ties dissolve, and then we are then born without tongue tie and lip tie and cheeks. That can happen at 11 weeks, right?
Yeah.
So if that doesn't happen and we look back and we see there was trauma and things that were beyond our control, yeah, I think there's like theoretically a way in which it didn't have its origin generations ago. But I would just have to say that the things that are set in motion epigenetically to create those issues, um, personally, I don't think they happen instantaneously due to trauma. But, then I'm going to say, but again, this is why we're in this place where we can't prove any of this.
Asterisk, asterisk.
Asterisk, I'm like, but anything's possible. And I definitely, I'll end by saying this little part of it by saying like, when I'm like with a family and we're navigating some of these for their babies or kids, and then when we look at trauma and I, hear these whispers of, um, what happened at 4 or 5 weeks, and maybe I'll give this example just
Yeah.
is like relevant, so or helpful to paint the picture. I'm just gonna say this family came in and they were like, "There's a tractor coming by," so I'm gonna get a little further. Just so I saw this family and they came to me because they knew their baby was struggling with feeding issues, and I said, let me see what I can do to evaluate. And I evaluate not only in the mouth, but all the bones, all the fascia, all the muscles, all the organs, and then I delve into what's going on underneath the surface. Well, pretty much within the first visit, the mom's like, I don't want to get a tongue tie surgery for my little one. I I understand, like after I explained it, I'm like, well, I can't change the nature of the frenum. I can't change the nature of those collagen fibers, but symptomatically, I could help a ton, possibly. Let's just see. And so they experienced dramatic change within like 1 to 2 visits. And they were like, we are not getting a tongue tie release surgery. And we're happy with that. I'm like, okay, I'm just here to be a support. Like, that's awesome. So let's,
Yeah.
I'll give my opinions. But then, like, and I journeyed with that family, and little girl did, amazingly well. But then 11 months old, she came in. And the big issue was mouth breathing and a ton of congestion and a ton of like tension there.
Yeah.
And so I evaluated. I'm like, in my head, I'm like, well, maybe this is when the tongue tie is presenting itself more, etc. The palate. But and I gave my opinions on that. But then, okay, so here's a moment I said, oh, it's showing up not as any muscle, bone, fascia, organ. It's showing up in the notochord, and that's the embryological origin of the spinal cord.
Yeah.
So I asked, and then I said 4 or 5 weeks is what I heard in this voice when I was listening. And so then I asked the mom, like, what happened at 5 weeks? And then she said, without even like, I never asked this question. And we've been journeying at least once a month since then. She said, this woman came to the door. She came with an urn. It was the ashes of her deceased husband, and she wanted to spread them in the yard because they used to live here. She's like, I just like was right away. I felt like a no within me, but then she had to like turn around and she was pregnant. She had to go use the bathroom or something like that. But her husband, who's just like a really nice guy, and we covered this stuff. He was people pleasing. He didn't say no, so he left it at like that. The woman put her ashes in the ground, and then the wife was so like disturbed by that it really affected them. And so I'm like, okay, I see there's an issue here, and I don't know what we can do except for, husband, I think you need to say no now to what happened then. And like, let's take 10 seconds to recreate this moment. And I knew in that moment, it wasn't for me to release the notochord, because technically you can't. It's an embryological thing that isn't there anymore. But I'm like, even the sternum, it wasn't for me to release. I'm like, here, put your hand here, work on the fascia, but it's not about that. It's about the no. And so they're like, we were in a circle sitting on the ground with Aurora, the girl. And so the husband says, no to that. I say no to you being able to do that kindly. And in the moment, like I felt when I checked, the fascia loosened and the mouth, her tongue posture changed, her floor of mouth loosened dramatically, her
Mm,
whole palate dimension changed. And they told me after that that was like radical change in all of those symptoms that they were noticing. So for me, I'm like, who knows? All I know is
yeah,
we're not looking at those things. If I'm not looking at those things, I'm missing out because I know that the Neel who didn't look at that would have said it's the tongue tie. And
yeah,
but I know that I'm going to investigate things to say no, it was actually more about that mom's voice not feeling represented or heard or understood, and in that case, the husband not standing up to helpfully promote a boundary. So, and I've navigated with that family since, and Aurora's like 2 years old. So it's been amazing to see like some of those things come up that just tell me it's so important to look underneath and underneath and underneath all the like surfaces we can before
right.
like for me before I make assumptions or like really clear clinical decisions.
Yeah, heck yeah. Okay, so I want to ask you before I go back to, before I ask a follow-up question, can you share your floor four, or do we have to wait for a book to hear
Yeah.
that?
No, the book is yeah, book is in progress. And yeah, now that I got done with so for a little bit of context, the floor four tour is done. Shout out to Kat for being a huge help for my process with that. Thanks for Alyssa too. I saw Alyssa on here. So
Yeah,
yeah, so now that that's done, I really am like excited to sink into the book itself and writing the book on the floor of the mouth. But inevitably, I feel more and more it's really about the floor four. And so for the last few trainings that I've done, I've been teaching the floor four. Um, and those four areas, like you're all kind of like, if I don't tell you, that would be unfair, right? As my daughter would say, she's like, Dad, that's not cool. You got to just tell. So, and it's very general, but it's the head, the throat, the sides, and I'll show you this, the sides. Okay, like right here under the rib cage, both sides, and the feet. If you like delve in, there's a lot more to each area. But when
yeah,
I'm teaching people, I'm like, if you know the floor four and you know them and you navigate them and you let your fingers know them, and you're checking these places in the mouth, like of course the floor of the mouth, the tongue, the front of the palate called the maxilla, the back of the palate called the palatine bones, and you're checking those areas in a flow of back and forth, you will see this point happen in the moment where you're with someone. I just got a testimony. I got to share these, but this person who came to my Chicago training said she's a myofunctional therapist. She's not a body worker, but so that's a lot of people come and they might be lactation consultants, they might
yeah,
be myos. They're not going to necessarily do body work on people, but they're going to do this on their moms, like this person did. She's been in the field for like I don't know 30 years, and so she went home to do this on her mom, and she said I did a few layers of the floor four, and my mom, like her mom was like 70, I think, had I'm guessing the age had such relief that like the rest was I don't know, but it's really amazing to see what just like bringing a scaffolding and a framework to working with these areas, the mouth and the connectedness of the body can bring in like pretty short order, short amount of time without needing to know a ton about every single area. Although the ones like Lindsey, if you're there, or there was some craniopaths, esoteric
yeah.
chiropractors who study craniopathy. They were there. There was like two of them at the Chicago training, and they're like, boy, head first and asking me questions about vectors of cranials and facials. And I'm like,
Yeah,
yeah, with you guys, I'm going to tell you all that. But you don't need to know all that. And even the people who know the most about all those things, I'm like, so they're the most gifted healers, gifted students of the knowledge of those things. But everybody, even like I've had a couple parents come to the trainings, and I'm like,
yeah.
you are gifted healers. You are gifted healers, and if you are, that you are putting your hands on someone and you want to see things happen. I'm just loving that this floor four is a really like distilled way to navigate.
Yeah, that's what I was thinking about. What is like parents, if they're not located near you or near somebody that has been through your training or even cares about this, but they maybe have had a birth outside the system, or they're at home struggling with a little one that's feeding, maybe 2 weeks old, 3 weeks old, is there a way for them to like do an overview of the head, throat, sides, and feet? Or should they just put their hands on their
Yeah.
baby,
Yeah.
What are your thoughts there?
So good. Yeah, so good. Like that you touched on the putting the hands on, because I do think for some people, I tell them that I'm like, before we do anything, first of all, let's just put our hands on the person we're partnered with in these trainings and
Yeah.
just acknowledge that area of their body. And so if you're like with your infants, like your baby or your kid, just like putting your hands like, and I say like, usually I'm like this on the head.
uh, like that.
Yeah, but if it's your own head, it's different, right? I'm gonna go like this. So if you're working on, somebody else's head, you're gonna be like this,
Yeah.
and then you just feel the head, feel whether there's tension in the head, and it's really to acknowledge that, but you're checking tension also. Then when you get to the throat, yeah, you can just gently put your fingers on their anterior muscles of their neck and your throat. But really, one of the main areas is the thyroid gland. But
Yeah.
if you just put your fingers where you hear yourself talk and you feel the vibration under your fingers, right? The voice box,
Yeah.
inevitably all that cartilage houses and surrounds the thyroid near the parathyroid. So you're inevitably going to get to that. So even just touching and talking or
Yeah.
you're going to hear the baby sounds, and then, touching the sides where you're under the rib cage and just a gentle squeeze
Yep.
like that, then you might be getting the kidneys. You might be
I'm
getting
thinking organs. Yeah.
several organs on either side. And then, yeah, the feet are really like if you're holding your baby and you're just flexing the foot,
Yeah.
dorsiflexing and plantar, point flex, and then the other way, evert, invert, just rolling, just moving somebody's ankle, your ankle around. Yeah, I think those are ways, just touching, gently moving,
Yeah.
and gently massaging are like three first ways that I would navigate these. And then
Right.
um you're you could do those and expect that's going to help the mouth. It's really nice where if you're wanting to really see things happen here, in the mouth, or just know that you are making change. You just, whether you get your gloves, wash your hands, you check in the mouth, or at least check the lips and the cheeks. And that's good. And you could check the tongue, and you could even wrap paper towel around the tongue if it's yours or your older kids, and stretch it out and do a plus sign and an X.
Uh,
But a lot of people though, before I ever do that, or even if I'm not doing that, they're just like, my tongue feels lighter. And or they're just like, it's easier for me to put my tongue on the roof of my mouth, which is ideal for
yeah.
and so I think a lot of people feel that. And then I get a lot of parents, patients alike, ask me, like, well, what about, a vibration tool? Like, especially, if they're doing it on themselves or, and I'm like, yeah, first of
Yeah.
all, be careful. Don't break the head usually, because that's sometimes good and sometimes not. But yeah, gentle vibration tool can work on these areas. Light therapy can work on these areas. I'm a huge proponent of violet light. Um, my one statement to say about that is like, I love red light and it's amazing. But for any of us that deal with tension, nervous system dysregulation, and like scrunched up, rigid, like, if you're carrying all the time your baby out in front, and then you're dealing with all this stress. Purple light is the color of the sunset, right? It's that hue that we get, and it's relaxing and settling and calming to your nervous system. So I'm a big fan of violet light. That being said, it's hard to, a lot of us have a red light laser these days. So use that. That's going to help on so many areas, these areas included on the head, the throat, sides, and the feet. But if I always love to say, like, if you're out in sunset, even if you're not seeing purple hue, there's purple, there's violet.
Yeah.
you know, no, I
I,
have my kids just jokingly. Somebody said this to me. They're like, "Do you just have your kids run around with their mouths open?" And I'm like, "No, I would like to say I do that more. I'm not. I'm one of those guys that's like, I need to be better at working on my wife and kids to like really help them way more. I still do, but then I'm like, yeah, but now I do. I was like, my kids, I'm like, okay, all right, guys, it's sunset. What do you need to do? And they're like, so right, get violet light in the mouth, and that was up so much. So, or especially on the
well, I'm gonna introduce you to my friend Nico here at the end, who's done a ton of research at the sunlight and quantum and circadian. Okay,
uh,
but okay, let me go back to that case you were talking about. Eat the light, she says. Love it.
love it. Eat the light. Yeah, totally.
um,
I
okay,
love
so
eating light.
with the Okay, I want to touch on this with the case you were just talking about where the husband needed to like verbally say no and put up the boundary. It makes me wonder, right? So, like, I'm definitely a believer where all kind of dis-ease or ailments start with an emotion. It just doesn't pop out of anywhere unless it's like a trauma. But even there, you could kind of argue like it started somewhere. Um, what Yeah, can you elaborate on like how emotions and like it sounds like okay, that woman experienced, the kind of an inauthentic emotion or a boundary that was crossed for her and that showed up at 5 weeks pregnant and that basically caused a roadblock in the development, and is there a way for us to like, as women, clean out our closets, before conception or even in pregnancy, because of so many emotions and things, that could get hung up somewhere? Or do you not? I know you think emotions, definitely influence the body. So, does that make sense?
Yeah, yeah. I mean, for sure. Like I totally like in that moment with that one, like, family we're talking about, it's like that was a case where both husband and wife were so tender, sweet. I mean, like
Yeah.
that family is so precious. And the husband's so tender and attentive to like what they need as a family. Um, and then in that moment, I'm like, what could have helped,
Yeah. What could have been different?
right? And in one way, it's like I think it's the husband needed to speak up more for himself. He needed to acknowledge that he didn't
Hmm.
feel like he had a voice. He didn't
Oh.
feel like he could get his needs met. He didn't feel like he felt confident enough to say no to this mom because he felt like he was saying no to what she needed because
Mm.
and so in that moment I'm gonna go back to what you're saying because I think we need to talk about that and but I think in this moment I feel confident to speak to what the man needed, not what women need. Because I hear my wife's voice saying, Neel, um, don't you think you're on a call with many women who are amazing, and don't you think they might have more more to say than you about what women need? 100% Dawn, 100% Lindsey. Yes, I could offer some keys here, but but actually authentically in the moment, I feel like that guy just needed more affirmation and validation. He needed to receive it if he never
Oh.
received it, or he needed to get it given to him, um, to be so in his place of like, yes, 100% to himself. I am here
Yeah.
in this moment, so I can show up for my wife because I clearly could tell she didn't feel good about this. So I needed to be tuned into her. But if he's not tuned into himself, he can't tune into her, right?
Right.
Fully.
Right.
So I think tuning in, antennae, raising like that interconnected line of communication between them, to be tapped into one another's emotions, like on that empathic, you know, person to person capacity. I think that was what was needed. She was tuned in. He wasn't. So
Yeah. Yeah. She
so
seemed like she was grounded in herself.
yeah.
But yeah, you're right. Like he needed a little more affirmation. Maybe that started somewhere long before.
Yeah. And you told me about his family. We delved into everything after that. So I'm like, oh yeah, I see. It's probably been there on that
Yeah.
journey. Um and then like I think I would say, okay, so one, I have three thoughts, and then Lindsey, I'm gonna turn it back to you and say, what do you think? And what are our keys? And what are things that I can like really encourage my female patients, or like just women in my life about that? Because what I don't want to do is say the onus is on you to handle
Yeah.
everything, to take care of everything. And I'm not saying you need, like in that case, the wife needed the husband to do everything so that she was okay. I just think, um, I just see a lot of people come in and they're like, what could I have done differently?
Yeah.
Not have eaten this? Should I have had this, folate versus folic acid
Right.
vitamin?
I shouldn't have eaten that, or it's like
No,
the one thing.
I can't tell you that that wasn't it, but I will tell you 99% sure I don't think that was it.
Right.
you know, and all of those things. So I think it's good to like take the onus off of ourselves, and as moms, as women, to say like, it's not about what you didn't do, but you know, how can we then like in whatever kind of like community or what kind of arrangement you're in, where you're like you have your people, your person around you, and I guess I'm locating myself to talking about like with parents and a baby, but I'm just, you know, like what if we're a little further, a couple months, I mean years, 3 years, 4 years, 5 years later, and we're just looking at like how can we gain keys about like, so a lot of like, you know, the moms will bring in their kids, and I'm like, well, first of all, like if I'm thinking of a 5-year-old, there's like so much that I can only speak to because I'm seeing your 5-year-old right now. And
Hmm.
we'll get all these things and play and get them on the table and then work, and then I'll find something and I'm like, whoa, I think that happened in utero, and it was, you know, diastasis, right? That was like
Yeah.
it never integrated, and whether this 5-year-old is a boy or girl, the abs never came together, and so therefore that's pulling on the mandible, the mouth, the tongue, and creating issues in here. So I need to help the abs integrate before I even work in the mouth, and um sometimes that can be really hard on the nervous system to integrate abs for,
Yeah.
especially if they're a little older. So and then I'll find like on the mom or sometimes even on the dad, like their abs aren't integrated. And I'm like, okay, how can we integrate as families before we are in these situations? Or like in my family, how can we integrate every day or often? Because inevitably we're going to go through these phases of life where issues come up again.
Right.
I do think like integrative practices are my favorite way to do that, where like emotions play a big role, nature, um, light, of course. And so, but I'll talk about my 5 M's really quickly. I have the
Okay.
five M's that I do, that I practice, and that I love teaching people. Like if they come to an intensive, which I don't call that because I don't like intensive, the word anymore. It's called a life reset. So it's more of a retreat, right? So we'll do the 5 M's, and that involves, you know, we might do so it's music, meditation, mapping, movement, and musing. Musing is like pondering. So these
Yeah.
5 M's, I can do the like 1 minute each or 5 minute each, or, you know, if I have more time, I'm going to do more minutes each. And it's an overlapping integrative, like, you know, sing for a little bit, and then I'll map what I sang, or I saw a seal getting swept over by water, and then I draw the seal. So
Mm.
things that I do. And then in that place, I'm going to come up with like, what am I feeling? How do I feel about now? How can I locate myself geographically, but as well as like, where in my body am I feeling what I'm feeling? And in that movement session that I do, which might be 1 to 5 minutes or more, I'm going to intuitively let my words on the page or the emotions that I'm feeling move me. But then I'm going to go back to like the meditation of, then I'll sit with it and I'll meditate and I'll say like, wow, you know,
Yeah.
gratitude for what I'm seeing. So I like the 5 M's as for
Love
me,
it.
integrative practice of how I can tune in, sense, feel, know, and then from that place of integration, move forward. And so loving to do that with my family when I can, so that I can bring them into that fold. And I do love teaching that to people when they're looking at what can I do? Because I think it is about
Yeah.
those things too. So, anyways,
No,
that's
I love that.
now, Lindsey, please teach us more knowledge. What are your keys on how
Well,
we can
how
do?
to integrate, how to stay connected, get connected, stay connected. I'm definitely, I'll back up and piggyback on what you were saying earlier. Like, I do believe in ownership and taking responsibility, right, for your life and your actions, be in action around your values. And because your everyday choices are going to reflect your values. Um, and also, we have to realize that that's such like our subconscious, our perspective is so minute compared to like this vast world that we live in.
Yeah.
So one phrase I love is like, we do the best we can with the resources we have in that moment of time. And, I think that phrase was really healing for me on my journey, going through, therapy and all kinds of things. But, knowing that my parents did the best they could with the resources they had at that time, and they love me, and then my grandparents, I don't know my grandpa on my mom's side, but my grandma. And if like, that you have a lot more compassion and, um, love for the ones that you want to blame or be angry with, I'm sure. But
Yeah.
if they did the best they can with the resources they had and they're doing it just like you, that goes a long way. Um, that said, when you were talking about these 5 M's, I love them because I was thinking about them in relation to like the 7 pillars that we have within BirthFit.
Yeah.
We have sun, sleep,
Yes.
nutrition, fitness,
Yeah.
mindset, community, and spirituality. So you could take the 5 M's and go within each of those pillars. And, I think the pillars that we use, I kind of view them on this like pie, and each one's a slice. And, it's going to be hard to be 100% in each of those pillars every time. But maybe that your community is a little lacking. Maybe you want to connect more with other women, other moms. Go do movement with other moms, or go to a music class, or go to a concert or something. There's ways to incorporate all that within that. um so I love, like, I feel like yours is such, the 5 M's kind of give the individual tools for the roadmap of the 7 pillars within that.
Well, yeah, I'm glad you mentioned those 7 pillars because I love those 7 pillars. And I remember a post that wasn't that long ago that you did on them, or it was like a reminder to everybody about these pillars. And I'm like, whoa, I love these pillars. They're so fundamental, right? And like,
They're so basic.
it's so basic. And I think like pillars are meant to support, you know, structures and like whether it's like the Coliseum or another building. And I'm like,
Yeah.
yeah. So if I'm going to build something, I want these pillars. Um, and so I guess I want to riff on that because I love the construction of those pillars because I really resonated with all of those pillars. And then I'm thinking like, because it's like I don't want to say the yin and yang, although we could totally,
Yeah.
the way that your structure provides is almost like in that case, the 7 pillars are a very masculine structure. This is awesome, right? Because we need the healthy masculine, we need the healthy feminine,
Absolutely.
and the 5 M's are a very feminine flow because it's all intuitive. So I
Yeah.
feel like the 5 M's is the feminine aspect that provides the flow between and like the waters that allow
Yeah.
the pillar to, to house the structure. So like in that way, I feel like the 5 M's do get us a place of fluidity and
Yes.
reflection so we can see like who are we in this.
Yeah.
Yeah, so I'd love to like
I love that.
follow up and talk more about that. That'd be cool.
Yeah. Well, you're absolutely right. And you're onto something, because the pillars I put as guardrails, as you
Yeah,
just said, as, a base to a structure, because we're used to living in this masculine construct. And especially women that, have found BirthFit, from the fitness world. When they come to us from the fitness world, it's very masculine dominated.
right.
And if you can get some guardrails, and that's what the masculine energy does. Like you said, it's like creates the container,
Yeah,
but we want to flow within the container. And that's what happens in birth, right? Like,
yeah, yeah,
ideally your husband's there, or whoever support you have, they are guarding the banks of the river, and you're flowing with labor down the river. So absolutely, I love that, the fluidity of it. Um, I want to ask, because I just saw it's like we got 10 minutes left, but anybody have any questions, throw them in the chat box, or unmute yourself before I get going again.
yeah. And I want to shout out to
Yeah.
my wife Dawn because, like, one I want to mention is that she's writing a PhD right now. She's done her academic work and she's right now in the nitty gritty of interviewing attendees. So she's writing her dissertation on embodied validation and the energetics of healthy emotional validation. And she presented at a somatic conference along with like Don Hamlin Johnson and Bonnie Bainbridge Cohen and Jill Miller and like Donna Leah Gold, like some of the legends of the field.
Yeah.
Was the only student in the PhD program at California Institute of Integral Studies that was a presenter, and she rocked everybody because she taught people about embodied validation, which is specifically what she's bringing to the field of knowledge. And then she takes people through an experience where they feel, distill, and write haiku, because my wife is a gifted poet, and
Wow.
put into this very compressed form what validation means to them. And what most people, I'm gonna have to move back again on what most people feel is that like they, whether they went through a lot of trauma and a lot of challenge, or they just never got like that embodied validation. Maybe they got a lot of people saying, yeah, way to go, good job, but to really just like briefly talk about it, but not like, yes, yeah, like you, Dawn, or whoever, you really are flourishing, and this is really who you are. Like getting that, didn't get that from her parents. So anyways,
Right.
so my wife has really got some groundbreaking work that she's writing. So if anybody's like, follow her, Dawn Bulchandani on Instagram. She's blazing with this passion, and she's about to like hit the world with some stuff that I'm like excited to be a little bit more location independent coming up soon, because we're about to see her take off and me get to be
Yeah.
more supporting what she's doing. So she's also got some keys on what we were talking about, Lindsey,
Right.
like
Y'all's work overlaps for sure.
regulating nervous systems and how to tune in and find where your emotions are if maybe you don't know where they are, things like that.
Right. I feel like, and you were just talking, what you were just talking about with your wife is like when the little ones come into their body, I feel like that is so key for regulation. And, I feel like there's different thoughts with different religions and when the soul enters the body and then when, I think I've been watching my little girl, like when she truly felt at home in her body, I felt that was probably somewhere between maybe 9 months and 18 months. Because then when she truly felt like, okay, I'm in this body and I get to explore and, have fun, she really wanted to go on adventures and, climb. And she started experimenting more and more. And I think, yeah, the embodiment part of being a human, stepping into that is wild. And if we miss it, like I was reflecting on my childhood, where I was somebody that was in ICU and had asthma growing up, very similar to you. So I didn't trust my body. I don't think I ever learned to trust my body. And that was reinforced through the outside of your body's not capable of healing itself. Here's a steroid, here's an inhaler, you know.
Yeah.
I think that really I had to learn to trust my body as an adult, like through practices. So I think it's so important to help your kids trust themselves.
Yeah. Yeah. Well, I didn't know you grew up with that
I
experience. Like,
did.
first of all, the ICU and then those inhalers. And I mean, I grew up on like 7 medicines a day, and I never trusted my body. So, whew, you hit on it. It's like, if we can't trust our bodies, like how do we locate ourselves and ground ourselves? It's a lot harder.
Yeah.
Yeah.
Yeah. All right, y'all, we got 5 minutes. I see Nico popped her face on here. If you want to unmute
Yeah,
yourself.
hello.
Hi, Nico.
Hi, nice to meet you, Neil. Lindsay's been talking you up. This was super interesting. I was just popping in the chat and then I was like, oh, wait, it's actually
You can
quiet.
unmute.
I'm at
Yeah.
home with 5 kids.
Yeah.
And so I had to take a walk. I'm now out in the woods. At first, Neil, I thought you had a virtual background because it was like so smooth and perfect. And then you started spinning around. I'm like, oh, you're
Yeah.
actually out there.
I'm actually out here.
Um,
Yeah.
And yeah, so I came in during the part where you're talking about epigenetic healing at home. And that's one of my big things, that when you read academic work, they're like, oh, we don't know, we don't know, we don't know, we don't know. But when you're actually out in the field practicing, you're like, yeah, we actually know there are lots of things you can do. So really appreciated the conversation that you were having there around how just these simple things, like we don't exactly know what makes the body uptake them, but we can see it happen and we can perceive when it's happening.
Yeah.
Yes.
I love that. And I love that you're like, you comment, eat the light, right? That's like
Yeah.
so it's so good. Yeah, some people are like, what do I eat and when do I eat it? And I'm like, hey, you might go through that journey and you have your naturopath or nutritionist, like that. But for me, I'm like, what color do I eat? When do I eat it? I want red. I want to eat the wavelength of red for today because it feels really good and I feel energized by that. So, I mean, I love lasers too because that gives us like high potent concentration. But even like your background, it's like beautiful green and blue. And so I love that.
Yep.
Yeah.
Mm-hmm. Yeah, nature has all the colors, not all the colors in all the seasons, but if you're getting out across, around the year, or at least depending on where you are, some are, 2-season places. I live in a 4-seasons place, and yeah, we get it all slowly.
Lucky. Slowly.
Yeah.
Uh, okay, I want y'all two to connect, so I'll introduce via email.
Okay.
Dr. Nico's done a ton of research, as I said, on the quantum circadian side.
I
And
love that.
y'all, yeah,
I'm really glad to meet someone that I can trust recommending for airway and tongue tie issues, because I do get quite a few women in my practice who are struggling with those kinds of things with their babies, and they get one diagnosis where they're like, well, they need to do a release, but I don't, my gut says that's not the right thing to do. Do you know of anyone I can talk to? And so when Lindsey mentioned this, I was like, oh, perfect. I'm gonna come and meet you.
yeah.
And
Now
yeah,
you
I'd be
do.
glad to know more about your approach for that. And so I'm wondering, like, do you have recommendations for women who might not be local to you? Like, I heard you talking about, laying hands on your own baby, and I think that's just so beautiful. Is that something that women can learn how to do, or like a way that they could have confidence with that? Because so many are just looking for those outside hands to come in and help them make the decision.
Yeah, I mean, first of all, like just giving credence to like your own hands and your own intuitive energetic structure of like that. And what I like to do is like I do virtual like one-to-one sessions where I
Okay, great.
like guidance and support. So I do that. And then I'm also just, I do have more people who are coming to my trainings and then so we're building up like the practitioner listing of people who have come. They might not do all the things that I talk about or most of them, but they do some of them. So at least there's going to be like a library of people growing that's growing too.
Mm-hmm. Okay, excellent. Thank you.
Yeah, you're so welcome, Nico.
Yeah. Yeah, it's so scary for them, and it always just feels like so urgent. Like they're
Yeah.
pushing formula on me, they're pushing surgery on me, and they don't feel like they have breathing room when these kinds of issues come up. At least, like a lot of people that are like
Yeah.
reaching out for help. Yeah.
Yeah.
Mm.
And I'm actually really excited to be talking about some more of that, that it's like we come into this world or where babies do or kids do with these breathing, feeding issues. And then we get into circumstances, even well-meaning circumstances. And like I could say, like, I don't do this anymore. I really try not to, but I try not to make things dramatic when I'm relaying information. Like, you have this and
Yeah.
I'm like, hey, I'm seeing this. Let's just see what we can navigate. But it's like in the healthcare field, they're getting people that are like providing them more cortisol spiking, more
Yep.
stress, invalidating, taking away their voice, hyoid bone, and taking
Mm-hmm.
away their ability to speak and move freely. And it's like, well, that's causing some overlapping issues from the actual issues. So how can we like really get to a place where we support people not only with like if they're in this journey of figuring out feeding for the babies and you're trying to navigate that, but then afterwards, how can we like take those stress levels down and like help people like acclimate to I might have a lot of like you might need to get the body work and you might need to get laser therapy or even releases, surgical releases, but or palate expansion, but we still have all the stress and the cortisol spiking and the nervous system regulation part is like, how do we bring that part down? So I think some of that's like I love sporting with that and talking about that.
Mm-hmm. Yeah, it's really important and missing in a lot of the professionals who are in this field, because I think even the practitioners who are seeing often aren't taking care of themselves in a way. So they
Yeah.
feel stressed and urgent themselves. And so it's kind of like a negative feedback loop where they have all these clients who are stressed stressed out, and then they don't actually know how to ground out, and then like
Yeah.
and then they pass on like from one client to the next of like all of these horror stories. And so
Yes.
yeah, right, Lindsay, you've seen
Yeah.
that.
Yeah. And it's well, it's such a beautiful example that, or I shouldn't say beautiful, but perfect example, negative feedback loop. And then also with moms, like if they're
Mhm,
stressed, baby's a hitchhiker on mama's nervous system. So
mhm,
if baby's colicky or has a hard time sleeping, that colic
yeah,
is not the root cause. It's a symptom of something else, something
mhm,
greater happening, you know?
yeah.
Love it.
So
Yeah.
important conversations.
Yeah.
Okay. Lindsay, can I
Dr.
give
Neil.
one more like minute thing, or we're
Yeah,
past our time, right? Do we
I
need to
know. Yeah, give one more
conclude?
thing and then let people know where they can find you.
Okay,
Yeah.
so you can find me here at the beach in Santa Barbara. Just kidding. You could. My office is. I have an office in Santa Barbara, and then in LA, and then I go up to the Bay Area once a month or every few months, and then, but if you punch in floor of the mouth Neel or floor 4, you'll see my name, but it's neelbulchandani.com or Dr. Neel Bulchandani on Instagram. That's where I am most. Also Facebook. Come check out my site and then reach out. Reach out on Instagram. I love to get your messages anytime, and we can connect there. One story that came to mind is this mom. She's an acupuncturist, brought her a baby. Baby was like, not doing well, was scheduled for a tongue tie release, and that ended up helping greatly. But before the release, we needed to make sure that she was properly prepared. The baby was, and he like came in that day, like his hypersensitive gag reflex was just out of control. And I'm like, oh, we had helped that a lot. But another layer came up, and this layer came up of I was listening, and I'm like, the fire, because they were really close to the fire when it happened in LA, Altadena, Pacific Palisades. And I'm like, oh, you know what? I think in this moment, I think he's afraid because he doesn't know the fire's not here. And so is that something where you guys like really scared? And she's like, we were. And I wondered if that affected him. And I'm like, you know what? I think you worked through that with him though. But right now, I don't know that he knows the fire's done because this was recent enough after it. So I just said, I feel like if you tell him if the fire's not here anymore, he will safely regulate. So she did. She told him, and his hypersensitive gag reflex went away. It was crazy. So I'm like, just knowing that they're so connected. And then how can we look at these moments and not make too little of them? Some people say, well, are we making too much of that stuff? No way. We are not. Like, I think people are making enough of them these days. For me, I like to say like, okay, but what is that doing in the body? And in this case, hypervigilance equals hypersensitive gag reflex. So I think like to look at the body as this place of like, we get to be stewards of these bodies and these precious ones that we care for. So if we're connected to them, we know they need something. So I really love to articulate very specifically, how can we connect to what we need? And then how can we unravel and untangle so that we can live these healthy lives? And that's just my little part of what I'm doing and get to explore. So what a privilege that I get to do this. And thanks for having me, Lindsay, to talk with you all. It was a blast.
Thank you. Where can people find you on social?
Dr. Neel Bulchandani is
Spell
my
your last name.
Instagram handle, and it's DRNEEL and then BULCHANDANI. So it's Dr. Neel Bulchandani. And then if you I have a podcast called Compromise to Alchemize. Lindsay, we're getting you on it soon. I'm so excited
Finally,
for that.
yeah.
So tune into that. Please listen and watch that. And then if you're like Google floor of the mouth and Neel, NEEL, and you'll also find me because that's what I'm doing these days.
Awesome. Thanks so much for sharing your time with us and your wisdom. I really appreciate it.
Yeah, my pleasure.
All right. Bye, everyone.
Okay, bye.